So it's very important for every doctor to talk about the source of the pain, and for each one of us to take the responsibility that the source of the pain is from here, and a little shift here and people will start seeing the shift in the body.
And in a way, pain can also be a trigger for greater awareness, right?
Yes, absolutely.
True. Sometimes you think about it that way, like, oh, pain, if you just link pain to, I need to be aware and get my mind.
Talking about gratitude, I have seen this in my practice. The patients who are grateful to you, who have that kritanyata, who have that, in their mind that thank you doctor, they heal faster.
Yeah.
100%. Versus patients who, ask you, doctor, my pain is there. Was there something which went wrong? Are you sure the surgery went well? Was there a complication? Then I thought you took so much time. Then they have the negative mindset, and those patients, believe me, take a longer time.
If I'm creating pain about any other issue, I am a radiator of pain to the body. So once I know, I just have to be aware that I'm radiating pain to the body. And when it manifests as a disease, I'm ready to do anything to get health back. Just do something right now.
A very warm welcome to another edition of our Think Right podcast. And we have here with us today someone who is not only the country's top knee surgeon, chairman and managing director of the Sancheti Institute for Orthopaedics in Pune, a milestone, a landmark in the city. But more importantly, somebody who's been able to, deliver cutting-edge healthcare with compassionate care. A person, a true wonderful human being, a very close friend, and a person who I've had the pleasure to know for a long time. And I can tell you that you're really going to enjoy something and learn something about how a doctor can combine, the aspects of life that are so important to make healing and joyful health as a way of life. So very warm welcome to you, Parag, Dr. Parag Sancheti. And of course, joining us in this podcast, as we all know, is not only the person who is the enlightened one and will help us guide through how this conversation can become more meaningful, but also someone who is the inspiration for what we are doing. So a very warm welcome to you, Sister Shivani. So Parag, we are here and we are doing this. Would love for you to share a little bit about you. You obviously come with tremendous legacy in this space. Your dad is Dr. Sancheti, a Padma Vibhushan, an iconic name in the medical fraternity, not only in India, but globally, in the same space as orthopedics. And you've come into the same area, and taken that legacy forward like, very few children can boast of, and your dad must be, I know he's super proud of what you have done and how you've taken it further. But take us a little bit through your journey and how you came to, to where you are today.
Sure. On the outset, let me thank you, Rajan, for this opportunity. I think this is a very special day because I've always looked up to Sister Shivani. She's my idol. And today I'm sharing a stage with her. This means a lot. It's really a great feeling. So thank you so much for this opportunity, Rajan. And, I've always been hearing about the Think Right podcast. I've heard some of them. So it's really a great feeling to be here. To answer your question, a little bit about my background and how I did come into medicine. So one thing, let me tell you straight away, is that my father not even once told me that I should become a doctor. But we were at that time staying very close to the hospital. So as a child, I used to go to the hospital, sometimes just, peep into the operation theater, see some operations, see how he's used to see patients. So at the back of the mind, that feeling was always there to become a doctor. In the 12th standard, which at that time, the 12th standard marks were, important to get admission to a medical school. And at that time, the corporation also kind of came up with a scheme of voluntary health scheme to go to the slums and examine children. So I said, yeah, let me do it. And so in the holidays, after my 12th HSC exam and before the kind of results came out, this scheme was announced. So I went to the slums and I used to see patients there and there's children there. And we had to fill out a survey for each of the slum family. And I did that. And when I saw them, the conditions they were staying, the kind of the sufferings they were having, so that kind of shook me a little bit. And I said, well, if I become a doctor, maybe I can help these people in some way. So that was a stimulation. And Once the results came out, you'll be surprised to hear this. I got 87.3%. Because of the survey, the health scheme which I had done, I got additional 3%, 90.3. And the last admission BJ Medical was 90.33. So I was the 194th student out of the 200 to get that admission. And so that kind of, was something which I started my medical school with. And then, of course, did MBBS, went on to do orthopedics. And when I joined my father, it was, as you said, like, a big tree. And I was, under that big banyan tree. And initially it was a little depressing, if I may say, a little frustrating, intimidating. But then slowly I said, if I have to get out of this shadow and I have to make something of my own, let me do something which my father has not done for so many years. And then I chose a specialty in the knee, the arthroscopy, which was not being done at Sancheti Hospital. I went on to do research. I went on to do writing chapters, and that's where I got my self-confidence. I really, started getting my kind of a thing done, and people were then seeing me as not as Dr. Sancheti's son, but Parag Sancheti.
And and you're a pioneer in that space, right? And I think
Yes.
that for sports medicine and all,
Right.
it's just helping so many people
Yeah.
in ways
Yeah.
that has never been done before. But all
Absolutely.
the things he talked about, was it destined to happen?
See, getting the three marks extra.
Yeah, no, that's what he's saying. That slum, and for an exercise which involved doing for others in a place.
But that did two things for him, no? First, he got that exposure. So he had that intention, I can do this. And then that karma already gave him the result in the form of marks to be able to carry out his intention and bring it into reality. Yeah.
And I think this entire area of orthopedic, is such a important one, because when the physical body is suffering pain, there's no way the mind can be at ease. I mean, no matter how, I think the strongest, I wouldn't know for sure, but the obstacle that the mind has to overcome is, of course, physical discomfort, but particularly when it comes to pain, because
Yes.
you get people who are crying in pain, to help them. And
Yes.
when you think of pain, how do you look at it? How does it happen? What is it? How do you?
So you'll be surprised, Rajan, that WHO has a definition for pain, and they say that pain is a physical and an emotional experience that has a feeling of unpleasantness attached to it, along with a tissue damage or sometimes even without a tissue damage. So that's the actual definition of pain. And I feel that there are two types of pain. One is the acute pain and one is the chronic pain. Let me very quickly tell you something about the acute pain. What happens in acute pain, that you get an injury, you get a burn, if there is something hot you touch, you suddenly, have a reflex. And that is the acute pain, which usually is the reflex mechanism of the body to make you aware that there is something wrong you're doing, and it gives you a signal to stop doing that activity. So that is acute pain. The chronic pain is a little different, which may be because of some nerve pressures, which may be because of muscle injuries, which may be because of neck pain, back pain. And this pain usually has some emotional connotations to it, some emotional disturbances. So this is the pain which we nowadays are dealing with. The acute pain, of course, the patient has nothing wrong before he comes with that injury, comes with that fall, comes with that fracture. We treat it, the fracture unites, the pain is gone. But sometimes there are certain conditions which has a chronicity, and during that chronicity, the pain becomes a little attached to various emotions. It has certain behavioral patterns, and sometimes it is attached to stress, depression, and that's the kind of pain also which we see and which we are dealing with. Though the acute pain is easy to treat and gets well, the chronic pain is something which one has to be a little mindful about. And I'm seeing more such patients who have what we call as the fibromyalgia, or pain which gets accentuated because of emotional disturbances.
Yeah, I think this correlation between emotional and physical pain is something that one can probably reduce the intensity of or avoid through certain practices, right?
Yeah, because depends on the cause of the pain, no? Like in the case of the acute pain, it's a cause is an injury, some injury. But in the case of this pain, it has been created over a period of time. It won't happen today I get stressed and today I feel pain. But if stress becomes my normal way of being, which the world calls normal, and then along with that, of course, our postures and but if that stress becomes a predominant emotion, it's there daily. So gradually that vibration is radiating to the body. Sankalp se Srishti means the first Srishti, which catches your Sankalp is the body. If other people can feel our vibrations, it's our body which feels our vibrations the first. So if there is pain here, few minutes, it's okay. But if I've started living in pain, let's say feeling rejected, feeling, anything, or trauma, grief, even grief becomes a very predominant pain. It just stays with people now for like 6 months, year. And you're not giving the space to the mind to even feel another emotion. It's just your predominant. So imagine, you just have to ask yourself, what is my body receiving from here? So over a period of time, it won't feel as pain only here. It will feel as pain here. But the reality is, we don't check it when it's paining here. We check it only after it starts paining here. And that means a lot of time we've passed. Because by the time it has to reach to the body, it's been at least a year or 2 years before the body will show the sign of the pain. And then also, after we experience the pain, we will only expect to go to a doctor and we want a medicine which will relieve us of this pain. But unless I do my part, then this is just going to be a pain suppressor. It won't be a healer. So, but then again, how long will you keep on taking that medication? Because you're not healing the source of the pain. So it's very important for every doctor to talk about the source of the pain, and for each one of us to take the responsibility that the source of the pain is from here, and a little shift here, and people will start seeing the shift in the body. Because body getting influenced with the vibrations of the mind is like very fast. If you get angry, you'll immediately be able to see your pulse, your heartbeat, you're feeling anxious going on stage for a public performance. Or it's so fast. You can see it immediately. Just before an exam, we used to feel it. So it's immediate. But this is pain which has happened over a period of time. Over a period of time. Failure, rejection, grief. These are predominant emotions which people are not healing. And now it's increased, right?
Yes.
Now it has increased because we're not working on healing our emotions. So then it's just there with us for very long.
This is the emotional part of pain. Sometimes even the chronic pain has some physical ailment. And pain is very subjective, Rajan. What I've seen is that sometimes something which may be, a slip disc causing pain or radiating thing, which may be perceived by someone, no, it's okay. I just get a little backing in the morning. I'm fine. But somebody might say, oh my God, I just can't stop. I can't get up in the morning, doctor. I got such a bad feeling and my day goes very bad. It's the way you perceive it. It's very, very subjective. And I have seen patients who have a little bit of a positive mindset or who are prepared to take that pain, they get healed faster. And sometimes some people just use it as an excuse and kind of a sympathy factor to just, show that they're having so much pain and so many, kind of experiences to bear with. So that's pain. It's a very, very different phenomenon.
Yeah. But the affirmation of the problem also, na?
Yeah.
It's like, my knees are paining. I can't walk.
Yes.
It's true. It's paining. I can't walk. But because I say it so many times every day, I can't walk. My knees are paining. I can't walk.
Yes.
So that affirmative vocabulary also will in fact pain.
Exactly.
And then you change your affirmation to, I'm perfect and I can run.
Yes.
And that's where healing will start happening fast.
So and this combined with the physical, what he says, there is a knee is something that he or the pioneer in knee replacement. And everybody's source of pain as they grow older starts because it's your movement.
Yeah.
It's your mobility. And when that gets affected, people are not able to kind of, think about it. So
True.
When you talk of knee health, right? I mean, let's take knee health as a subject, since that's your expertise. How do you keep the knee healthy? One, of course, is through the right affirmation.
Yes.
But what else is needed to keep the knee healthy? This is every child or every son or daughter of an aging parent should know.
Yes.
And it's good if they know it early, they will make sure their knee is still healthy.
Yes. So, the knee is a very important, joint of the body. It is the largest joint in the body. And it is the bridge between the hip joint and your ankle joint. So any lower limb disorders, any lower limb injuries, which are in the knee will affect the whole walking pattern, will affect the whole, locomotion system. And also sometimes that can affect your spine and the upper limbs as well. So knee is a very important joint in the body. I always tell my patients, take care of your knees and you'll be fine. Especially after the age of 50, what happens is there's a wear and tear process. The cartilage of the knee starts getting worn out. And then you've got to listen to your body signals. If the signals are there, you're getting pain while walking, going up the steps, you're doing meditation, and while getting up, there's some pain. Obviously, there is some wear and tear going on. So, immediate medical attention should be sought out. Do an x ray, diagnose what the problem is. And what they say, a stitch in time saves 9. So if you know there is most of the common cause of pain is osteoarthritis. There are various ways, you can do exercises, physiotherapy, change of lifestyle, which can prevent further deterioration and avoid any kind of surgical intervention. So that's the importance of recognizing pain and take care of your knee. I compare it to like a car tire. If you drive your car well and if the pressure is good of the tire, the alignment is good, the balance is good, the car will run well. So the knee is something like that. Maintain it, don't use it roughly, don't abuse it. Otherwise, you have to change the tires.
What else can you do to keep it healthy?
The second thing is nowadays we have a lot of these newer medicines which help to, maintain the cartilage authenticity. And what these medicines have is something called as a chondroitin and glucosamine sulfate. So they have the natural ingredients of the cartilage. Nowadays, we also have certain biologics and certain injectables. So there is something called as a hyaluronic acid injection, which if given in the joint can maintain the integrity of the articular cartilage and prevent degeneration for a long time. So these are the newer drugs which are coming, stem cells, adipose tissue injections. And I feel the day is not far when probably knee replacement won't be required or may be required in fewer patients, once these biologics and intra-articular stem cell injections become, absolutely a useful injection. The research is still going on and probably 5 years is the time I would predict for it to be really efficient and working well.
Yeah, but this alone, without the mind, the healing, the affirmation will not say. I mean, many a times, this problem gets solved, but that pain continues because the mind is not letting go of that pain. Like what you...
The mind is not just letting go of pain of the body, but even if the mind is creating pain about any other issue in life,
it will reflect this.
So it's not just that I'm troubled about the health issue. If I'm creating pain about any other issue, I am a radiator of pain to the body. So once I know, I just have to be aware that I'm radiating pain to the body. And when it manifests as a disease, I'm ready to do anything to get health back. Just do something right now so you don't reach that stage.
It's interesting because you said, you get angry, you feel it. All the things that we talked of are causing disharmony in the body.
Yes.
Through a mind because of thought. What is it that will reverse that process? Right? I mean, constantly keep you healthy. What are those affirmations or what should somebody be telling oneself besides, yes, I am healthy, but what is the...
No, it's not just affirmations. It's your way of living life. Be reacting. Even this whole thing of being busy and running and just feeling you're racing against time, that itself is stress for the body. It is. Easy. We have a lot of time, but it's here. It's this whole thought process here. Then someone has a nature of controlling. Everything has to be my way. This is not my way. This is all taking a toll on the body. It's not just anger. Anger, irritation are a very visible thing. Okay, we can see it. The typical personality traits, always feeling they are tight on time, always feeling I'm not loved, nobody loves me, nobody cares for me. This victim feeling. So any emotion which creates pain here will radiate here. So just shift the pain here, heal yourself, change the way you are reacting to situations. Just remember, it will be expensive when it comes on the body. So just take care. This year we saw so many people just leaving the costume, just due to a heart issue. So nowadays in every program I say, just put your hand here and say, just for my heart, I will just respond better in this situation. Even a little awareness, at least 2 out of 10 times, somebody will respond a different way. But otherwise, if you get angry, get your work done. Shout at the person, get your work done. You shout at the person, get your work done is fine. You deplete yourself here, you affect yourself here. Now choice is yours. So it's only our way of living here which is obviously going to affect our body this way or that way. So when we have people come into the center learning meditation, the first result is on the body. I'm feeling better, my blood pressure getting better, my this is getting better, without having done anything medically. They're still on what they just feeling better because they are feeling better. So mind body connection, very, very, very deep. This way you can take it towards a disease, you can take it towards healing.
And in a way, pain can also be a trigger for greater awareness, right?
Yes,
I mean,
absolutely.
You know, sometimes you think about it that way, like, oh, pain, you know, if you just link pain to, oh, I need to be aware and get my mind,
Yes.
you know, sorted. Because most thing when you see pain, you say, oh, which doctor do I go to?
Yeah.
Can we change the conversation? Can any young person or older person, whoever seeing this podcast, when you see pain, first think of the mind before the doctor. Sorry, doc.
No.
Then mind.
No, we can see the doctor also, but also take the personal responsibility that it lives in our
Pain is all in the mind.
Yeah.
And I can just tell you one example about pain, how the mind can play on it. I was coming back once from Mumbai to Pune by car. There was a accident we had, and it was a bad accident. My wife was with me. She had an injury. She had a head injury fracture. I had a collarbone fracture. Both of us were in pain. And, you know, I really get goosebumps. Our driver, we lost him in that car accident. And next day was his funeral. And I said, I have to go to his village. I had a complete collarbone fracture. I was having immense pain, but I don't know, that emotion of being there for his family and being there for the funeral. I went there, I attended the funeral, and when I came back to the hospital, oh my God, the pain was excruciating. But for those 6-7 hours, by the time I went to Saswat, came back, there was no pain. And then when I came, I had to get admitted and I had to get treated for this. So, and then it took good 2-3 days for that pain to go off. So it just shows that it's all put in the mind. For that moment, what was important for me is to go there. And that time there was no pain. So how do you explain this?
And if everyone thinks about this, they would have had experienced this.
Yes.
They would have experienced this where something prioritized over your physical pain.
Yeah.
And either you prioritize or you distract. You know, if I just distract myself, some part of the body is paining, distract, you know, watching a movie, doing something, you forget the pain. After the movie, so we're like, oh, it was hurting. So then the family will say, acha, till now 3 hours, it was not hurting. Now I'm telling you to do this and you're saying it's hurting. Because you just took the mind from there to something else. So in this case, he took the mind from there to something which was more important. And that's it. When the mind shifted there,
The pain was gone.
Yeah. So much teaching. And how do you imbibe this and bring this thinking into medicine today? You know, you run a hospital which has, of course, grown. You're also, you know, leading the Orthopaedic Society and the associations. You know, how can we see this happening more at scale? The combination of this, so at least this learning, because then it's up to the person to do.
So that's a great question. And I must admit here that Sister Shivani has visited Sancheti Hospital a couple of times and she gave me some great ideas. And we've been following those ideas. The first idea she gave me that just keep playing some shlokas, mantras in the corridors, in the passages. And we've been doing that every day morning. You know, there is a Aarti in the Ganpati temple and the whole day there are some chants going on, number one. Number two, she said that we must make some kind of a meditation room. So we are the first hospital who have a meditation room, especially, you know, people always short of space. So we made a meditation room where whenever the patient is in the OT, we tell them, please go there and just give positive vibrations to your patients. And I must tell you, you know, this is a little bit of anecdotal experience, but patients have shown that we've been doing this for a year. Better recovery. So that's the second thing. And very recently we launched the No Anger Zone. This is again Sister Shivani's concept where we are putting up posters, we have put up holdings, and you know there are lectures being taken very periodically and people are made aware how No Anger Zone can help the patients. Because I feel if the doctor is getting angry, the nurse is getting angry, the patient is already, you know, in a bad shape. He has pain. He is coming to you not because of anything else. And if, you know, not behaving with him sympathetically, empathetically, and with passion or compassion, then the pain is going to only increase. So there's No Anger Zone. We have started, and every day at 12 o'clock, there is a 1 minute kind of a different music comes in, and people are, whenever they are not in any emergency or not, you know, directly with the patient. They stand still and just meditate and think for a minute. So we started all those things, and believe me, it helps. And I am very convinced that activities like these give positive vibration, positive mindsets, and make the patients heal faster. Absolutely, I don't have a doubt in my mind. And we've started these 3 initiatives.
And I think this is now moving into corporate offices and in many other areas as well. This is state of
Especially
mind.
hospitals, because everybody's coming in pain, not just physical pain. So maybe the disease was caused because of emotional pain. Even if not, once I know that there is a disease in the body, there's emotional pain.
Yeah.
There's worry, there's fear, there's financial anxiety. And then it's not just my pain. Even the caregiver is in pain. Even they are anxious. And in today's world, so much time management, wealth management, so much has to be done. So we always say the healer, which means the doctor and every healthcare professional, everyone, right from the person at the gate to everyone who's in a healthcare premises, they are subjected to pain throughout the day. They are the receivers of the pain because it's a vibration of pain. A patient will come for 1 hour, 1 day, 10 days. They are there all their life. Morning to night, they are in a vibration of pain. So if a vibration of a temple or a place of worship can calm you down, a vibration of a hospital can create fear, anxiety, worry, because that's the predominant emotion everywhere. So at least the healer, which means everyone who's in the healing, they have to start taking care of themselves, because otherwise things here are affecting the healthcare professional, because it's very stressful is what they will say. So they will say doctor means extremely stressful. It is not the treatment which is such stressful for them. I'm sure you can wake up in the middle of the night and go and do a surgery now. That's not the stress. It's the vibration of stress in which they live from morning to night every single day. So they are living in a lower vibrational energy. So at least they have to take care of their energy, lift themselves every day. So building your emotional immunity system so that you will be there in that environment, but lesser impact. Like if he's a doctor and we are the patient, every 10 minutes he's meeting someone in pain. So he could be talking, treating, writing, but he doesn't know he's actually receiving so much pain in 10 minutes. And then we go out, comes the next patient, go out, comes the next
It's very
patient.
important for the doctors to be careful about. So you do a lot.
Yes, I think it's important because, as Sister Shivani rightly said, everybody is in pain and we have to give them the right vocabulary. If we don't be at a higher vocabulary than them, and this is again, I'm quoting Sister Shivani, then the patient is probably going to get the better of you and you will start feeling emotionally depleted. And you have to see every 5 minutes I'm seeing a patient on, every day I see 50 plus patients. So, and they are full of, those negative vibrations for that moment. And that is why they're coming to me. So I have to make sure I do that. And what I am trying to do for this is I meditate every morning. And this affirmations is something which I have learned. And I do that every morning. I have a few affirmations which I do for the patients, and absolutely that is something which has helped me to stay calm, stay quiet, and make my patients achieve optimal benefits from the surgery.
Now that we're talking of affirmations, because it's always, people are skeptical, right? Oh, how do you want me to say this? And what I say, how will it happen when I can see everything is very, very different? You've had some personal examples with your son.
Yes.
No?
Yeah.
Did you
So,
share that? Yeah.
so this is a personal example, experience we had. And my son Aman was in 12th standard. And at that time, because of COVID, what happened is suddenly from going physically to class every day, there was this virtual teaching, and he could not really cope up with that. And so this was something about 3 months were left for his exams. And then, you said, why don't you speak to Dr. Shivani? And you gave me a number. And then I contacted her and, Sister Shivani. And that time I didn't know her as well as I know her today. I knew of her and she knew of me, but I just took the liberty of calling her up. And, very promptly she said, okay, we can do a Zoom call. And that time meeting physically was not even possible. And Aman, Archana, my wife, and me along with Sister Shivani were on the Zoom call, and she talked about affirmations. She asked Aman, what do you think will your score be and how much do you want to get? So he said about 625, 630 out of 710, 710. She said, no, make an affirmation that you will get 670 marks in the NEET exam. And every day morning, he used to say those affirmations. My marks in the NEET exams will be 670. And believe it, when the result came, his marks were 671. And he got admission straight into BJ Medical. He could have gone into KM Mumbai, but he went to BJ because it's in Pune. So that's the miracle of affirmations from a student who's losing confidence, who's thinking whether he should give an exam or not. And he bounces back, gives the exam successfully and, scores so well. I think thanks to Sister Shivani and the affirmations she gave us.
There's one more thing that happened. One day before the exam, he had a terrible cough, very bad. And Archana was there and we connected again. He said, this is going to... I said, you just have to create an affirmation 3 hours. 3 hours, I will not even cough on. He said, no, how is it? I'm coughing. I said, just create. I said, I'm doing it every day. That 2 hours on this day, I will not cough even once. So don't worry, it will work. And then he again shared his experience. He said, before the exam, I was coughing. After the exam, I was coughing. But 3 hours, I did not cough even once.
Very true.
There's so much happening from
Power in the mind.
These are my
Personal experience. Feel that just people should just try it, because once you experience it,
yes,
then there is no, there's.
So he didn't create an affirmation just for the marks. It was also, I'm powerful. Because
Yes,
it was,
there were
obviously
9
the
others.
child is intelligent. He already had that capacity of that 670. But scenarios and what was happening, they were all locked in homes for 2 years. So he was just a little low on confidence. That's all. And also it was the time where there was so much worry and fear in the air.
Yeah.
Otherwise only because of COVID. Yeah, that's why. So it was just affirmations even for his nature, for his personality, that I'm powerful, I'm confident, this is smooth. And most important affirmation we put is that the exam will be a smooth experience. It's not just the marks. Marks are important. But today's time, it's important that the exam is a smooth experience. You get stressed and you achieve 670, we don't call that as success. You're stable and you achieve your marks, that's us. So those were 8, 10 affirmations he wrote and he did it. But the beauty of it is that the child did it religiously. Religiously, he's done it religiously.
Absolutely.
So that also becomes his experience now. I said, now you use this power of affirmation whenever and wherever you want to go, and especially as a doctor.
No, now you go. There you go. Now he'll come into the next generation.
Of course, he has.
Probably your generation.
And come with something, more than this. When you think of the future of your institution, again, how do you see that? See, because modern medicine, like you said, right? Everybody's dealing with a fear of being disrupted. You yourself said, you know what? Knee surgeries may not be needed tomorrow. I'm just saying, you've gone and added new infrastructure, everything to do that, and that is happening to every business today.
Yes.
Suddenly you think you're doing something and there's something that comes around the corner that is not. So there's uncertainty. There is this, again, how do you hold your mind through this journey? Do you think about it? Or
Yes, that's an important.
for a doctor, it's very tricky because you don't want people to, I don't want people to fall sick. So they come to me. I mean, I'm just saying, at the same time, you also have to run an institution. I mean, you're a doctor personally, but you also are responsible to stakeholders. You give jobs to so many nurses for which the institution needs to run.
Yes.
How do you deal with that?
Yeah, so I think for that, the most important mantra for me is stay with the times. What is going on? I always attend conferences. I always read journals. And, there's so much of information and I try to do that. So what we did at Sancheti Hospital is, we made super specialty orthopedic departments. Now, orthopedics is a general branch. We have joint replacement, we have sports medicine, we have spine surgery, shoulder surgery, foot and ankle, pediatrics, trauma. So there are many super specialty. What I did was we got 2 or 3 people with each specialty and they do only that. So they become better at that and they treat only patients of that particular ailment. Number 2, we got all the equipment because orthopedic surgery is all about getting the equipment because it's precision. Whenever we're operating with the spine surgery, the spinal cord is so near. So we have something called as a neuromonitoring. We have an intraoperative CT scan. What CT scans are done in the Department of Imaging and Radiology, we do it in the operation theater. So all these things really add up to it and that is what is required. And along with this, the most important thing, what I have, our motto or our tagline is Rugna Seva, ye Ishwar Seva hai. Treating patients, serving patients is serving God. So that is what we actually follow. So all this packed with, spirituality, with compassion. I feel that a person who prays every day, goes to the temple for 2 hours, but comes and shouts at his patients, doesn't give them time. And what is the use of those prayers? I would rather, use that half an hour to talk to him and heal him, because you're a doctor and he's in that situation, he needs you. And I take lectures every month once to, about 50 people. We have 1250 plus staff at us, and tell them, what is the importance of serving patients. Serving is like serving God. And then they feel up to it, they feel good, and I'm already seeing that difference. So I think that is what has, made us different. That is why we are one of the leading institutes. Treatment is there, patients will get well, but you need that compassion and empathy and that patient experience packed in with it.
And that emotion behind everything you do.
The intention behind the
And it's exactly that, right? If that is in the right place, right things happen.
So seva bhav, no? Everyone can have this intent of seva bhav, not only doctors. Even a business leader can say this is seva. I'm giving to the world. Our energy is thinking that money earning means energy has to be like this. No, money will come, but your intention should always be like this. Unless you shift your intention to be like this, you will not become a giver in the world. You'll always be standing like this.
As a restaurant, I can feed people well. I take every, if I'm a fashion, I'm dressing people well, I'm making them look good. You take any industry, you can feel the goodness and why you're doing that and make that the intent. And make it like a serving your customers. And we know that works, right? Especially when you put it as a tagline. But to actually have that intent
Vibration.
while doing that makes a huge difference.
But if the leader has the vibration, like he's the leader of the hospital, so if he has that vibration, and then he also makes effort to radiate that vibration, not just have that vibration. So like talking to his people, reminding them again and again. Sometimes one person has that vibration, but an organization, a hospital is hundreds of people. The staff.
But then businesses will have targets. I mean,
Yes.
many of the people.
But hospital will also have, they also have to earn.
So that person who has to deliver the target, for them sometimes these are practical discussions that you have. You say, either you want me to deliver this outcome or just be kind and, let go of things, right? So I think
the way you are doing it.
The way you're doing it, that's important.
The way you are doing it is with care and compassion. The intention with which you are doing it is with care and compassion. And the intention is that this is a selfless karma. The result of that karma will anyways come. But you would just keep your purpose higher. But if you think, my purpose is only to clean this room of the hospital, my purpose is only to come and give the medicine, then you will just do it without using the emotion of seva over there with you. But if you keep that seva, that this is healing, and they earn so many blessings. Healthcare profession earns so many blessings, and yet they're so stressed. So always, if you're earning so many blessings, you would be always light and happy, provided you're just remembering that. So if you remember that you're receiving so many blessings throughout, and you just take care of yourself emotionally, they need to take care of themselves emotionally. So the reason we have no anger zone in the hospital is that anyways you are surrounded by so much pain. At least don't react and become more vulnerable to receiving that pain. So every time you react, you're dipping your vibration. So you're not going to move away from the pain around you, but raise your vibration so that their pain doesn't influence you, but your power heals them. So every doctor is not just healing the body, they're first touching the mind.
Yeah.
You see, if we go to a doctor with all our confusion and our panic, it will take time for the treatment to start or for the surgery to happen. But if I meet a doctor who's very calm and kind, and then their vocabulary is high vibrational, my mind will change just meeting the doctor. I will come out of the room and say, I'm sure, तो मैं ठीक हो जाऊंगी बिल्कुल यहाँ पे. Once I have that shift here, my body is going to respond at another pace altogether. So the doctor is not just what the doctor is doing. The doctor is who the person is. That person is influencing the healing before the treatment begins. Absolutely. Treatment is second, very important, but it's the second part of my first treatment starts with the impact that the doctor's vibration will have on me. And if the doctor's vibration is here, then they can shift the patient here. Body will respond faster, especially in today's time where people are going with a lot of doubt. They can sit outside his OPD and check every single thing on their phone. And we're hearing so much, oh, this happens in healthcare. One piece of information is enough for me to just doubt everyone around me. So we've come up from an era where blind faith we had on the doctor. And that really paid well because we would heal faster with that blind faith. Now you're getting so much information. Check. Why did they ask you for the scan? Why did they say, was it their target of the hospital or what did you? So we are going with all that baggage to a doctor. So if faith can heal, doubt can slow down healing. So the doctor cannot convince me that it's right if I'm going with my doubt. But if that doctor is at a higher vibration, then you will meet that doctor. Your doubts will all just disappear because that vibration will overpower you. And I will say, forget, let the world say what they want to say. I'm sure I'm with the right person. And that doesn't happen with their certificates. Normally when we go to doctors, they have all these things put up on the wall, which is good. Their awards, they always tell them, this doesn't impact. This doesn't. I already researched all this and that's why I came to you. But when I meet you and that vibration, all the doubts will disappear and the body will respond faster. So it's really the moral responsibility of every doctor, every nurse to keep themselves at a higher energy.
It's moral responsibility and it makes them better because all those surgeries or whatever they do will also be better because
some people are able to do the surgery very well, even if they are stressed, because that's a skill. You can master a skill, but some of us are mastering the skill, but not mastering this skill. But if they do both, so they will get those beautiful results. They will create miracles in the medical fraternity. And most important, they will not get influenced by the pain of the people. So both ways, it is good for them. One, they are not absorbing the pain because they've taken care. Second, they're radiating power.
Yeah. As a matter of fact, we were talking of, the power of affirmation and that faith is like, I'm affirming. Why? Oh, Parag is going to cure me for sure.
That is an affirmation.
Right? Like when we talk of prayer, you go to a particular deity, God, you say, Bhagwan, you are going to, problem is yours, I'm going to, because you go with faith, it's actually the affirmation. So if you go and really, now I think scientifically, when you can prove that the power of an affirmation of the mind changes the situation out, I think that's where spirituality, science,
really all come. Some people say, मैं सबके पास गया, but मैं यही डॉक्टर के पास जाके ठीक होता हूँ, मैं यही डॉक्टर.
Because you have that faith. Yeah. That's the power of faith. If the patient has that faith, which sometimes you can see, you can make out that this patient is asking so many questions. He's not trusting you. Of course, he has to ask questions, but the way of asking it is either, kind of a disbelief in his eyes and checking, okay, is this right? Is this right? This has a mobile down. I think that's not a good thing. And it's up to the doctor how to change the mindset. And what, sister said is absolutely right. If you're at a higher vibration, automatically he will, have faith on you. And it's up to you how to convince that patient. For me, I have seen, whenever I see that kind of patients, I give them extra time. I talk to them. And, instead of talking negative, no, now nothing, this condition cannot get better. You're, done for it. No, don't worry. This is something we will make it heal. It's going to take a little time, but just be patient. I can assure you, you're going to be all right, in 6 months' time. The patient goes back with such a happy feeling rather than there's no treatment. And I know at the back of my mind that this is going to take time. There's possibly this might not get better. But when the patient goes out, he's already feeling a lot better. And that's what I learned from my father.
Yeah, I was about to come.
No, you just win the patient.
Known as a jovial doctor, always.
Put that, pat on the back and that you find. You don't require surgery. You just take these medicines, do the exercises, physiotherapy, and you'll be fine. And they actually get fine. So medicine at that time, Sister Shivani, I am an allopathy doctor, but let me tell you, it acts like a placebo. More important is the mindset which you send him, that now, I'm going to get better no matter what. And they actually get better. And that's the power of, positivity and sending them with, a positive mindset that they are going to get better.
Yeah, but we are able to do that only if the doctor themselves are going to remain in that positive mindset. If I'm just saying it, then it will not touch the other person. But if I myself am doing that and then saying it, then that impact on the person is much more. Yeah. That's why they all need to do it. And they all need to work on their mind. In the sense, because they are they are in high risk situations most of the time. So carrying the rest of the things, stress, anger, is not for health. It's actually not for anybody, but definitely not for anyone in a healthcare setup.
And that is why, this course which I did, in Mount Abu, mind, body, and medicine, not mind, body, and soul. And that they tell you it's a 3-day course. You go there and they really teach you how to be positive, how to, make the patients cheerful. And it's a whole science. 2.5 days of that, and going for the meditations in the morning, eating the prasad, going to the langar is a beautiful experience. And I did that. And I'm telling you, I picked up so many points in those days where I am able to really heal my patients better. So that mind, body, and medicine. That's where they teach you how to remain at a higher vibration. That was a fantastic course.
You use everything, and now in medicine also, people talk of natural medicine, allopathy, homeopathy, different exercises. So it's a holistic thing, but all focused on mind, body.
Absolutely. Holistic is the new word now, in medicine. And I'm happy to say, even in orthopedics, we have a holistic approach.
Yeah.
It's not necessary that only my allopathy medicines are going to get the patient better. If patients ask me, doctor, can I take Ayurvedic? Can I try homeopathic? I said, please do. As long as your pain goes with something, it's what I want. And once I say that, there itself is half.
There are a few other emotions, right? Like being grateful. I think gratitude in a patient. Do you see them, because others are resisting, do you see them healing better, faster, because you've created no anger zones?
Yeah.
Does that make patients grateful for what is there? Or, which are some of the other, we're telling patients, these are the things you should try and bring more in your life. Gratitude.
So talking about gratitude, I have seen this in my practice. The patients who are grateful to you, who have that krutadnyata, who have that, in their mind that thank you, doctor, they heal faster.
Yeah.
100%. Versus patients who, ask you, doctor, my pain is there. Was there something which went wrong? Are you sure the surgery went well? Was there a complication? Then I thought you took so much time. Then they have the negative mindset, and those patients, believe me, take a longer time. I remember one patient, he asked me at least 10 times. This was a knee operation which I was doing, and there's a nerve called common peroneal nerve. So he read somewhere that this nerve can get damaged during that surgery. I said, no, I've done so many operations. It hasn't got damaged. No, doctor. Will it get damaged? How will you prevent its damage? And he went on asking me, and this is a real story. Post-operatively, he did get a common peroneal nerve palsy and a foot drop. That was, and that was the first time. First time it, thank God it recovered in 8 days. Yeah. But then he got
Power of affirmation.
So he was thinking that he's going to get it. And that's Murphy's laws.
Yeah.
He happened to him. So that's, I don't
So many, with health and with pain, this is a very natural, because what you say, your fear, your mind takes over. And then that is, it's a vicious cycle.
Yeah.
Worse gets, absolutely this. And then what you're saying, it can actually land up happening. And then when you say, what was the source of that? Well, it was my mind.
Whereas,
so what did you need to heal,
Gratefulness.
Yeah.
That belief, that trust, that faith makes all the difference.
Yeah. Trust, gratitude, patience. Nowadays, you can see, we've come from that era where we were like this for a doctor, for a teacher. It was like always. But today, people feel that, we are paying you the money. They will actually react sitting outside just because they had to wait 15 minutes more, and they can make So when we put no anger zone in a hospital, it's not for only those who are in the hospital working. It's also actually for the ones who are coming there. Because think about it, the other person is serving you in pain throughout the day. The least you can do is be polite to that healthcare professional. Even if that is a sister or there is a ward boy, they think they have the liberty to just, because they're not looking at it as a service industry, right? Because how we shout and scream at service industry, we think we're paying you, but it's not good for you. So just have that patience, pray, meditate in those 15-20 minutes if you're waiting for the doctor. You will heal faster. They get irritated, impatient, and then aggressive, sometimes abusive vocabulary. So it's not going to harm the other person because they've got used to all this around them, but it's affecting your body. So that's everything that, we have to think about, that it's not just, that's why we always share with doctors. Tell the patient half the responsibility is mine, the rest of the half is yours. I can only do 50% of the work.
Wonderful start.
I can only do 50% of the work. And you know who told me this? It was an oncologist. And he was going through cancer 4th stage. And he knew he will not come out of it. And we had gone to meet him and we were just talking. And he says, what did I keep telling my patients all my life? We said, हम ठीक कर देंगे आपको, हम ठीक कर देंगे, आप आ जाओ, हम ठीक कर देंगे. He said, it's not a reality. He said, this is not a reality. He said, I won't even say 50-50. You know, he was in another mood that time, that zone. He said, I would say 40% we will do, 60% you have to do. He said, if we take up that 60% responsibility as a patient, that my mind is also going to play an important role, then we can create miracles in medical science.
There's a humility in doctor. Yes. I am going to heal you. Yeah. I am the one who has given you life. I am the one who has taken away your pain. No, it is natural, right? But sometimes one has to kind of...
Patient's mind, caregiver's mind. Even caregiver's mind sometimes, you know, just people around you creating panic at home or even in the hospital, and the mind of the doctor and the mind of the people assist. All these minds are part of the healing. The procedure is only one part of the healing, but all these minds are a part of the healing. So patient's mind. So if we, we say, write it on a prescription and say, 50% is the treatment, 50% is your mind and the vibration of your house. If you're going to take this medicine, but you're fighting at home, you're shouting, screaming, it will take you longer. So let's tell them.
You increase 1 extra week, whatever description.
I actually feel that we can write there, meditation, affirmations.
Yes.
And that is what makes the difference, because sometimes you see that, a patient comes to you and, there are miracles which I have seen. Like especially in the ICU, when we see patients of polytrauma or multiple fractures and there are ventilators, and within like 8 days, 10 days, they just walk out. Versus some patients come who have absolutely, a small fracture and they develop a complication and they, succumb to that. So how do you explain that? I think there is some kind of a family vibration or his past karmas or something which is attached to it, which makes miracles happen. And I have seen miracles, Rajan, in my practice, which have definitely, made me believe that there is something beyond medicine. What we say? Dawa and duwa. I will give the dawa. She has to give the duwa. The family has to give the dua. The meditation has to give the dua.
So dua means every thought.
Yes.
So dua is a higher vibrational thought. So mind and medicine together will work on the body, and then we create the miracles. Not just say the medicine will cure me. My mind and your medicine together.
So, we see the medical world progressing at a very rapid pace. We have to see the world of the power of the mind move along, because then we will find people living over 100 years. All the things that we are talking of longevity, it cannot only happen through medicine. I think the mind and, body working together. So, it's been a super conversation, talking, and I don't know how we spent an hour discussing this already. But, we have one last segment.
Sure.
Parag, it's called the Mindful Minute. So we'll just ask you, a few questions which can help, our audiences, understand crisply certain things. So let me begin with, one orthopedic myth that you'd like to bust.
The orthopedic one myth is that pain is damaging to you. Actually, it's not. Pain can be taken in a good way. Pain is a protective mechanism. Deal with it, overcome with it. Don't take it as a negative connotation. So pain is not damaging. That's the myth I want to break.
A big mistake that people make with particularly with joint health. What's that one mistake?
I think the one mistake they make is, delayed consultation. They sometimes try to self-treat and this will get better. And sometimes, some meniscus tear or cartilage pathology, which I could have treated with medicines, when they come, it's too late. So I think early attention is something which I would say. The mistake they make is they just kind of stay with it, try to self-medicate. And when they reach the doctor, it's a little late. So that's what I would say.
One habit that has changed your life.
So one habit for me is, praying every day morning, meditating and saying those affirmations. I think there are 3 habits which I don't step out of my house unless I've done those three.
And how much time does that
This is about 25 minutes in the morning. I have a temple in the house and sit there and do all these things. So that is one habit which has changed my life.
One belief that you think limits people the most? One belief that you think limits people?
I think one belief which limits people is that they feel that there's only one way to do things. I think there are many ways to treat a patient. So it's not necessary that only allopathy can treat a patient or only my treatment. I think we have to look at it holistically. There are so many other factors apart from your medicine and your expertise which can heal a patient, which can cure a patient. So give it some time. Think it as a holistic approach.
If not a doctor, what would you be? That's the last one.
So I think I would have been either a counselor, because sometimes I can pick up patients' signals. I can talk to them because of, patients waiting outside. I limit my conversation. So I would have been a good counselor, or maybe not, if not a good event manager. I'm very good at organizing events. So maybe one of the two.
Well, what would you think? Can we end with that he should be or he can be, or what he can do more from where he is?
Once you are creating beautiful sanskars, whatever you do, you'll do it beautifully. Just the being to be taken care of, whatever doing is going to be happening, it acha ho jayega. So just be beautiful here. Whatever you do, it will be with a good vibration. So that's very important.
There you go. You're one being who's making so many others beautiful, and here we have a being who is also beautiful. So on that wonderful note, we bring this podcast to an end. What a wonderful, enriching conversation.
Thank you. Thank you so much. This is a very special day for me, Rajan. Thank you for the invitation.
Well, thank you for being here. And I think whatever we've discussed, let's hope it, reaches out to as many people
as many
and makes the difference as to as many ways we can. Thank you.
Thank you. Thank you, Sister Shivani. Thank you, Rajan.
You too can start or enhance your mindfulness journey using the Think Right app on iOS and Android store. It's got a huge number of daily affirmations, daily journeys, daily meditations that will enable us to hold your hand as you move in this transformative journey of life.